Hi there, and thank you for joining UnSCRIPted. My name is Angela Kashuba. I'm Dean of the UNC Eshelman School of Pharmacy. We have an amazing community here at this school, all focused on solving the world's most challenging health problems. I'm excited for you to hear stories of our faculty, staff, students, alumni, and partners. And today I have invited Arif Khan, who is the Vice President of Pharmacy Services from Blue Cross, North Carolina, to a conversation. Arif, thank you so much for joining me today.
Thank you for having me.
I understand that you're a Tar Heel.
Indeed.
Can you tell me about your story and how you came to Carolina?
Yeah, absolutely. So I born and raised in North Carolina, so born and bred here. You'll find out when I say y'all. It kind of gives it away. But grew up here in Raleigh and went to school around here. And really growing up, there was really no other option than coming to Carolina. For my parents, education was always a staple for the family, and the idea was always you're going to work really hard, do really well in school, and you're going to go to UNC. And so when it came time to apply for school, UNC was top of the list, and I got in, and I was happy to be here. Once I got here, the best thing about UNC was no matter where you go, what school you pick, or kind of what you want to do, you're going to end up in a great school. I started out, as many students do, as pre-med. I got my first C in chemistry and decided we're going to reroute. And then, I set my sights on the undergraduate business program, and got into that after my sophomore year and was excited, and from there was history.
And what brought you into pharmacy services?
Yeah, it's when I was in the healthcare practice in the consulting firms I started out with when I graduated from UNC, there was this whole world of what's called the PBM space, right? So if you think about a health insurer, they help you get health insurance. There's two worlds to that, right? There's the medical side and the pharmacy side. And so what I learned is in the pharmacy side, a lot of that function is not built inside of a health insurer. So a lot of times there's these separate entities, sometimes called middlemen, known as PBMs or pharmacy benefit managers, that help manage that work on behalf of the health insurer. And so I found myself helping to procure those, for example, for different Blues plans. I found myself consulting for some of those pharmacy benefit managers to help them understand what a health plan or a health insurer might want from them. And that kind of started my career in understanding the business side of how pharmacy works in the healthcare spectrum.
Okay. Tell me about your day-to-day. What does Vice President of Pharmacy Services at Blue Cross North Carolina do?
Think of me as overhead. No, I'm just kidding. It's a fun job, and I think the best part about my job is I get to do a lot of different things. So when you think about the scope of work, the easiest way at the macro level to think about it is all things pharmacy roll up to me. So I have a team of about 150 people, and they're kind of split into 4 what I'll call verticals. Those verticals are, in essence, to align with how the company is structured as well. So every day, I'd say my job is spent making sure across that team that all those verticals are working well to help our membership, right? And we have about 1.3 million pharmacy lives that we cover. And the idea is, across the state of North Carolina, and the idea is you're helping people, one, get access to their medication. So that means all the processing and stuff that happens of adjudicating a claim, making sure that prior authorizations, if they're needed, are put in and approved. Any kind of network issues that might happen with getting a pharmacy in network or something like that, all that stuff kind of rolls into my team or management of the PBM who helps support that work with us. The second component of it then is thinking away from the operations, then medication adherence, helping people understand what medications they're taking. Do we have clinical programs that we want to refer them to? Because, hey, not only are they taking a couple medications, maybe they're taking them for diabetes, and we've got a diabetes program that we might want to help them get enrolled in so they can help manage their diabetes better. So some of that is then the sort of clinical work that supports the operations piece. I'd say the third kind of key component of my work, and a lot of this is in partnership with our pharmacy benefit manager, is how do you innovate in the industry, right? So if you think about how pharmacy works, it's worked one way for a very long time, and I think people recognize that the system is not working as it should, right? There's not enough transparency, costs are too high. So what can we do, and how can we innovate, finding strategic partners or different companies that want to work with us to change the way this works, to make things more transparent, to bring costs down, and to make it easier for our providers and members. So that's what my day-to-day kind of at the macro level is. At a micro level, I'd say I've got a team that helps support all of that come to reality and come to fruition. And it becomes exciting work for a pharmacist to be a part of that ecosystem.
Yeah. So tell me what you love most about your job.
Yeah, that's easy. It's the people, right? Okay. So Blue Cross has an excellent culture. It's about supporting one another. Our sort of motto is we won't stop till healthcare is better for all, and I feel that, right? People are committed to it. As a not-for-profit insurer in the state, we're not there to make a ton of money or squeeze people. The idea is we want to bring costs down as much as we can. We want to make the process as simple as possible, and the people that are dedicated to that mission usually are pretty cut from the same cloth, and it's good to be around those people.
What are the greatest challenges that you face currently?
Yeah, I'd say the greatest challenges in pharmacy are probably when you get down to what it's there for, which is providing care and medication for members. It's too expensive, right? And so I think the biggest obstacle we face is creating some affordability around this space. Mm-hmm. The second is healthcare is tough, right? It's a behavior change business. Mm-hmm. Nobody wakes up in the morning and says like, oh, I can't wait to take care of my health today, right? Or go see my nurse, or go see my pharmacist, or go see my doctor. So you have to get people engaged in their care. And that also means creating sort of an informed consumer, right? Because a lot of times people don't understand the medications they're taking, don't understand why they're taking them, don't understand the effects of if they stop taking them, what happens. A lot of times you see people take medication for a little bit, start feeling better and say, good, I'm good now and I don't need to take it anymore. So those are probably the biggest challenges is one, getting it affordable and access to it. And then two, helping people be informed about what they're taking and why they're taking it.
Yeah. So it seems to me the pharmacist kind of being the most accessible healthcare provider, you could walk off the street and you could see a pharmacist, plays a big role in all of that and trying to keep people motivated to take their medications, to help them manage their medications. How do you see from a Blue Cross perspective working with pharmacists to be able to provide those services to patients?
I'd say Blue Cross sees pharmacists as probably one of the most important providers in the care continuum. As you just referenced, a lot of people see their physician on some interval, but it's probably not as frequent as we'd like it to be, right? Mm-hmm. You might see your PCP maybe once a quarter if you've got a chronic condition, and oftentimes less than that, right? It's really just an acute need and you're sick and you want to go see them. Whereas with a pharmacist, if you're filling a prescription and you're on a chronic condition medication that you're going to have to fill every month, you might walk into that pharmacy and see the pharmacist every 30 days or even less sometimes, right? And so we see that touch point in the healthcare system as critically important to helping members do all the things we talked about, right? Mm-hmm. Understand why they're taking that medication, have a consult with a pharmacist who understands and can explain to them what they're doing and why. So we see pharmacists as critical.
So as we think about our students who are out in the communities and working in community pharmacies, we hear a lot on the news these days about some community pharmacies just having one pharmacist in place or not having the time to be able to spend with patients. How do we encourage our students around the patient care aspect of community pharmacy and being able to have that time to spend with patients?
Yeah, I'd say it's critical to find time to work with the patient, mainly because if you can't help the person understand why they're doing what they're doing, the chances of them continuing it are pretty slim. So I know that there's a push and a pull here, a demand for pharmacists in the retail pharmacy setting or community pharmacy setting where they're also trying to just make sure things are in order, make sure processes are working the way they should be, make sure the order is happening. Like I said, it's a complex system with PBMs and insurers and providers. So there's a lot of process that happens. And so it's never easy for the pharmacist to find time. But one thing I've learned, every pharmacist I've ever spoken to, I think the one thing that makes them the most passionate about their work is the idea that they'll get a chance to connect with the member or the patient. So they want to do it. It's actually it's probably more on all the other stakeholders in the process, whether it's the insurers or the providers, the PBMs, to make sure that there's time for the community pharmacist to have that ability to do so. I'd also say it's not just about process. Sometimes it's about incentives, right? So you have to make sure that people are being reimbursed properly for their time. That's something Blue Cross is committed to, is making sure people who are doing consults, for example, in the store and spending that 15 or 20 minutes extra with the patient to help them understand, maybe even do a comprehensive medication review, are then being compensated for it so that they feel like they're not just spending that time on their own dime.
Right. No, I love that. I love that Blue Cross is focused on that. That's great. I also understand that you like to give back by mentoring others. Can you talk about that a little bit?
Yeah, I've been very lucky in my career to have what I'd say is excellent mentorship throughout the course of my career. So even you asked about, how did I stumble into pharmacy? One of the reasons was because I just had a pharmacist who was a great boss and mentor to me and kind of taught me the business side of pharmacy, not being a clinician myself. And so I've always wanted to give back because, whatever I've achieved in my career is probably very little to do with me and a lot more to do with the people around me. And so I recognize being able to give that back creates meaning and value to the work I'm doing. So wherever I can, whether it's internally at Blue Cross or externally, I'm looking for people to help support in their career and give them advice so they can hopefully outdo all of us and fix what is unfortunately a difficult system in healthcare to work with.
Yeah, lots of challenges, but lots of opportunities.
That's right.
As well. Yeah. Tell me a little bit about your family.
Sure. They're the pride and joy. So my wife and I have two beautiful little children. My son Yasin is 7. My daughter Noor she says 5.5. She's turning 6 in about a month. She doesn't know what 5 3/4 is just yet. So we've relocated back here to North Carolina after being away for the last 8 years, and it's been a blessing to be back.
Yeah, it's I love the community that's here because it's very friendly for families, and there's lots of activities to do with the kids really close by.
Oh, yeah.
So can you talk about some of the things that you do with your kids?
Oh, yeah. So we, right now, a lot of the time is spent probably because I'm pushing them into sports.
Okay.
So we find ourselves right now in basketball, which I also find myself coaching those things, which is good for me, and I think good for them. I've been pretty fair to them on the team. So both my son and daughter are on the same basketball team because they also aged into the same group for now. So it's perfect because that means one less practice and one less game a week to have to coordinate. So basketball. They also were doing soccer in the fall and spring, which I'm also coaching for each of them, which has been a lot of fun. So it keeps me active, keeps me out there, keeps them busy. And then we just enjoy just so much stuff to do in the Triangle, right? There's beautiful parks, heading out to any of the gardens around the area. You can kind of at any point stone throw away to be away from a beautiful park where you can take the kids out and just enjoy the greenery in the area and a lot of the trails. So we find that happening often. And then, of course, the campuses, all 3 universities, to be frank, are beautiful. And so we find ourselves there often.
Oh, that's terrific.
Yeah.
Do you travel at all?
Travel a lot. So we travel quite a bit. We enjoy traveling quite a bit. So, with the kids where they are in their age group, it's been mostly relaxing vacations. So things like the beach, maybe a short flight to the Caribbean or something like that.
Oh, nice.
We've not done a lot of, we'd like to do some touristy stuff, but we haven't had a chance to do too much of it yet with the kids where they are. But we tentatively have a trip booked to Disney World. So that'll be exciting for the kids. And we're excited to see it.
Yeah, that's terrific.
That's right.
I understand you're also highly involved in your community.
Yeah.
Yeah, can you talk about that?
Sure. So part of finding value in work and kids and family is also then giving back. We talked about mentoring, but also giving back to community. And so where possible, I love to get involved. Certainly when I was in Baltimore, I spent time on quite a few boards. One that was notable being for Baltimore Medical System, which was one of the largest federally qualified health centers in the area. They served about 50,000 patients a year, mostly underinsured or uninsured. And so you really felt like you're making a difference. A lot of that also a refugee population from refugees that had relocated at that time from Syria into Baltimore. So it was just a really good chance to give back and be connected in the community that way. Once we moved down here, there's one that's been continual for me, which is the R3 Winners Foundation. So unfortunately, it's the tragedy that hit, obviously in Chapel Hill in 2015 when the 3 students were murdered. One of them was a good friend of mine. His name was Dia Barakat. Yep. And so coming out of that tragedy, of course, was an opportunity for a lot of good to happen. And so there was a foundation formed by the family called R3 Winners. And the idea behind it is to, in essence, remove implicit bias and try to eliminate hate from the world. And so we've got a foundation where we do a lot of grant giving out into the community to help support that. So that's been really meaningful for me as well.
Wow, that's terrific. What a wonderful legacy.
Thank
as
you.
well. Yeah. If you had one piece of advice, putting your mentoring hat on, for our pharmacy students, what would it be?
One piece of advice. I'd say there are 2 traits that I think are incredibly important in anybody I ever talk to or recruit for myself. And they go hand in hand. And so what I would say to them is they should work on being, we'll call it smart, and they should work on being personable. And I'd say those two traits are probably umbrella terms and they have a lot of kind of sub meaning to them. But the reason I picked those two are, the example I always use is I could find somebody who I think is one of the smartest people I know. If they're not personable and I don't want to work with them, it's not going to last for a long time. And if you flip that switch, right, and you say they're somebody whom I love, they're my sibling and we're blood related and I want to do everything I can to support them, but if they're not smart enough to get the work done, I can't keep them around for long enough. So those are two traits I always tell people to try and find a healthy balance of. And they should also recognize that smart doesn't necessarily mean best GPA or best grades in class. That was not me. But it means somebody who's willing to work hard enough to learn what they need to learn. And on the personal side, there's a lot of environments and changes in corporate cultures where sometimes there's a push to make things more, I'd say, aggressive and cutthroat. And I don't sort of gravitate towards that. I find myself saying you can always do good by also being good. And so it's important to be nice. It's important to be good. It's important to have tough conversations, but you should be personal enough where people feel safe and want to work with you and know that they can get a straight answer out of you.
Yeah, I love that.
Good.
Thank you. Those are wise words.
Of course.
Arif, thank you for being with us today. I really appreciate your time.
Thank you for having me. It's been
a lot of
excellent.
fun. Yeah. And I'd like to thank you also for joining in, for watching. We love to share stories of those who make the UNC Eshelman School of Pharmacy excellent, including our partners. And I hope you will join us for the next episode of UnSCRIPted, conversations with people who are advancing medicine for life. See you next time.